thinking that having aches and pains is just part of getting older, and there's nothing that you can do, you just need to manage and live with those pains. But what if that isn't actually true? And that's what I'm going to share in this video, how the aches and pains that you're experiencing as you're getting older, you don't need to just live with them. There is something you can do, and it's a really simple method. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach, and I support people to free themselves from pain so that they can move pain-free every day. So as we get older, we start to feel pain, we start to have stiffness, aches and tension, restrictions in our body. And we just think, or lots of people think, that it's just part of being older, it's just part of getting older, that our body is getting stiffer and tighter, and there's nothing we can do, we just need to manage those symptoms, maybe with medication, maybe with exercise, but they're not going to go away, we've got to live with that pain. So over time, due to gravity and the way that we've lived our lives, we take on habits, we're not consciously aware of our posture, and we start to compress. So we may not sit with our shoulders back and down, we may hunch forward, so we start to fall into the body. We may not stand correctly, we might lean to one side. So all this is compressing the body. And as we compress the body with our arms internally rotating, our legs maybe out too wide, or our feet pointing outwards or inwards, all these little changes to our body, to that perfect alignment which nobody has, that starts to create those aches, that stiffness and that pain eventually that we feel. This compression compresses the fascia in the body, and the fascia in the body is connective tissue, and one of its jobs is to help us to stay upright. So it's trying to keep us upright, so it twists and turns and locks us into that alignment, whether that's a forward rounded posture where we've collapsed into the core, whether that's shifting our weight to one side, so we're shifting our body weight to stand on one side and maybe kick out our leg to the other side. All of these little changes are causing the body to become restricted. The blood and oxygen can't flow freely, and that causes the pain that we experience. As well as compression, we're not always breathing from the diaphragm. So we start to compress into the body so that we become smaller, and we're not necessarily breathing from the diaphragm. We start to breathe from the chest. So when we chest breathe, we get 6 times less oxygen in the body. And when we've got less oxygen in the body, all the cells don't have the oxygen they need to function properly. So they don't have the blood and oxygen that they need to do their job correctly. And then when we are compressed as well, there's not enough space in the body for them to do their job as well. So we don't have enough oxygen in the body, we're not breathing or exhaling correctly, we are collapsed into the body so that there's less space, and all this is creating that pain and stiffness that we're experiencing. So what can we do to help ourselves get out of this compression that has caused us to get smaller, potentially wider because of the ballooning that's happened as we fall into the core? We can start to decompress the fascia, and we can also start to breathe from the diaphragm rather than breathing from the chest. And then when we become aware of our posture, how we should be standing and sitting, those 3 elements will help to get rid of the aches, the stiffness and the pain throughout the body. This is something that we do in block therapy. It's the 3-step approach, and it's daily habits consistently over time that turns back the hands of time. It helps to unwind all that compression by creating the space that's been lost. And when we connect to that breath, we can breathe in that oxygen, we can exhale all those toxins out of the body so the cells have all the nutrients they need, and we can get rid of all the toxins that we don't need in the body. And then we're aware of our posture, aware how to sit, how to stand, so that we're making those little adjustments every day. This is a practice that takes time to unwind, but you can get out of pain. It isn't something that we just need to think as we're getting older, we're not now able to sit on the floor, we're not now able to do the things, bend without feeling pain. We can change things. And this is where block therapy comes in. Block therapy decompresses the fascia. We do this by using a wooden block, the block therapy block buddy, or we can use a tightly rolled up towel, and when you're first starting, and we connect to the diaphragmatic breath. So we place the block in various positions so that we can connect to all of the body, because it's a full body approach to get out of pain. We connect to that diaphragmatic breath, We start to create the space in the body, inflate it with the breath, and then we are aware of that posture, making sure that we're sitting and standing whenever we're able to notice our posture to correct it back into that alignment to support the body. I have online classes where we cover the full body. You can just use a rolled up towel to get started, and then you can invest in the block therapy block. There's a link in my description to join a class. And if you're interested in just knowing what the belly position is first, there should be a video on my screen now showing you the belly position, which is always the first position we do in a block therapy class. So thanks for watching, and I look forward to seeing you in class soon.